Hello everybody, welcome back to our channel Nursing Career Club. Today we will discuss about Home Health Aid Unit 10, Consent, Observing, Reporting and Documentation. Let's discuss with the introduction. As a home health aide, you play a crucial role in ensuring consent, observation, reporting and documentation in the care of your clients. So, as a home health aide, AHHA plays a crucial role in maintaining the consent, observation, and reporting and documentation in the care of patients. HHA has some responsibilities which are explanation to clients, respect for anatomy, documentation of consent, monitoring health status, reporting symptoms or changes, documentation of observations, timely communication, follow reporting protocols, collaborative reporting, accurate record keeping, regular updates, etc. So, in the documentation, there are many things such as AHHA plays a crucial role in maintaining the documents for the client. When a patient visits to the hospital, then the HHA reports to the doctor and the doctor prepares documents for the patient, and he also think about the symptoms of the patient and what are the symptoms of the disease and what is the situation of the patient, and according to the situation of the patient the doctor provided proper treatment to the patient. Definition of consent. Consent means that acceptance. Reporting is oral communication between care providers that follows a structured format and typically occurs at the start and end of every shift or wherever there is a significant change in the resident. So reporting is such a thing that when the HHA goes to the doctor and gives reports about the condition of the patients, and he also tells about the proper treatment and the medicines. Documentation is a legal record of patient care completed in a paper chart or electronic health record (EHR). So documentation, if a documentation are recorded as a legal documents, and the medical records also recorded on the digital sites. So, in the documentation, there is only the detail about the symptoms of the patient and about the proper treatment and which medicines are given to the patient and what are the vital signs about the patients. Definition of observation. Observation means your documentation must be precise and coherent so others can understand. Vague and obscure documentations can lead to misinterpretation. So your document should be visible, and what is written on the document paper should be readable by another persons. So a doctor mentions on the papers that what is the situation of the patient, what are the vital signs and what are the body symptoms. These all things are maintained on the paper sheet, and this detail also maintained digitally. Documentation should be specific and individualized to each client. Your documentation should balance being comprehensive and concise. So your document should be specific and in a specific way and individualized, and every individual should have their own recorded documents, and the doctor provides the documents to the patient while the treatment is going on, and documentation is very important part for the treatment of the patient, and he can take several types of services throughout the documents. Definition of reporting. Reporting means that when HHA gives reports to the doctors about the patients, that is called reporting. In description, we will discuss about reporting. Reporting involves communicating observations, incidents, findings, or outcomes to relevant parties or authorities. So, report is a form of observation, incidents, and any kinds of things that occur at the time of the patient's treatment, and the results of the patient's symptoms, and which kinds of medicines are provided to the patients. These all things are stored at a one place. Reading reporting increases visibility in all aspects of the project, including team performance. And a reporting can be extended throughout the visibility of all aspects of the project, including a whole team of a hospital. With greater visibility from reports, the project manager can be in more control to act on progress. If we talk about the visibility of from reports, then reports should be visible for each and every person and for the patient also, because report is a very important thing which plays a crucial role in the treatment of a patient, and the documents are very necessary for the patients. Stagnation, regression, team performance, or quality of work. Project reports are sources of learning, and the project reports are a source of learning. And there are many types of reports and records which are kept in security with the patients, because the vital signs and the medical symptoms, and about the medicines which are provided while the treatment of a patient. So all these things are very important for the patients. So these things are kept confidential in accordance to the patients. Records are administrative tools used to classify and prevent duplication of the information. Reports. Report is a document form which include conclusions or findings based on facts or recommendations concerning the patient. Definition of documentation. We have earlier talked about the documentation. Documentation involves recording and preserving information in a systematic and organized manner. So documentation can be completed with the help of HHA and the nurses by the doctors, and the doctors mentions about the medicines and the way of treatment of the patient in the documents, and the documents are kept confidential and in a organized manner. Any written or electronically generated information about client that describe the care or service provided to that client, and these documents provide the information about the admission of the patient and about the discharge of the patients, and which kinds of medicines are provided to the patients. These all in, this all information is saved in the documents, and a patient can take every news from the documents. Observe changes in patient's overall condition. As a medical health, we will discuss about vital signs. What are vital signs? As a medical health professional, your eyes, ears, and nose are your tools for observing symptoms that could indicate a problem. If we talk about the vital signs, so the vital signs are such a body symptoms, and our body parts also observe the body movements and what are the symptoms of our body while a disease is going on. So our body parts like as eyes, ears, and nose, these all feel the symptoms of the disease, that what kinds of disease we are suffering from, and all the symptoms, signs about a disease. So this is all about vital signs. Pay close attention to your clients at all times. Taking blood pressure is one way to assess the health of the circulatory system. So we need to pay a close attention towards our clients at all times. And taking blood pressure is one way to assess the health of the circulatory system. And blood is a part of the circulatory system, and blood flows in our whole body, so that our body works and the parts of our body works and our sensory organs also work because of the flow of the blood. So blood circulation is a very important part of our circulatory system. Now we will talk about physical examination. When a patient visits to the doctor, then the doctor takes the physical examination of the patient, and the doctor asks this what are the body symptoms and how are you feeling like. Then the patient gives his feedback to the doctors, that what are the vital signs and what are the body symptoms. This is all about physical examination. Now we will talk about symptom assessment. As a medical health professional, your eyes, ears, and nose are your tools for observing symptoms that could indicate a problem. If we talk about symptom assessment, then a doctor assesses the body symptoms of the patient, and the doctors think about the treatment of that particular disease, and the doctors also provide a proper medicine for the treatment of the particular disease. Pay close attention to your clients at all times. Taking blood pressure is one way to assess the health of the circulatory system, and our blood plays a crucial role in the circulatory system because our all body parts work when our blood flows in our body. So this is all about symptom assessment. Now we will talk about mental status evaluation. It is related to behavior and response. We talk about behavior, eye opening response. Then one is no response to pain to speech spontaneously. Verbal response, no response, incomprehensible sounds, inappropriate words, confused, oriented to time, person, and place. Motor response, obeys command, moves to localized pain, flex to withdraw from pain, abnormal flexion, abnormal extension, no response. This is all about the mental status evaluation. We can also say that if our physical health is good, then our mental health will be good. If we take a proper nutritious food, then our body will work in a proper way and our mental situation will also be good, and we can think about a lot of things, and we can feel happy at any time if our mental status is good. So this is all about the mental status evaluation. Now we will talk about fluid intake and output. So what about the intake and output? Intake means that we take water and we drink tea and we drink juice. That is intake. And output is such a thing that when we passes our urine and we passes our stool, that is output. Most physicians, if asked to distinguish between signs and symptoms, would reply in a fashion something like this. So, if we ask a question to the doctors and the physicians, then they will reply about the intake and output. A symptom is a manifestation of disease apparent to the patient himself, while a sign is a manifestation of disease that the physician perceives. And the doctors also pay attention toward the body symptoms and what are the body symptoms of the patient and what kinds of the disease the patient has. So the doctors will also convey about the intake and output. And simply we can say that when we drink water, we drink tea, we drink juice, that is totally an action of intake. And if we talk about output, then the urination and passing stool is the part of output. This is all about fluid intake and output. Now we will talk about medication effects. For main side effects with medicines, drowsiness, fatigue, rash, skin eruption caused by drug, diarrhea, constipation, stomach discomfort, nausea. So there are several side effects of the various medicines. If the patient is not taking the medicines on time and according to the advice of the doctor, then the medicines can fall a bad effect or side effect on the patient's body. So a patient should be careful while taking the medicines because this is very important for the medication management. This is all about medication effects. Now we will talk about laboratory and diagnostic tests. Chronic diseases include asthma, heart disease, stroke, diabetes, and arthritis. There are several diseases which are needed for a laboratory diagnosis. So the patients goes to the a laboratory for the proper diagnosis. There are some types of diseases which are needed to be diagnosed like asthma, heart disease, stroke, diabetes, and arthritis. These are the diseases which are needed for the proper diagnosis. These diseases often can be prevented or controlled keeping risk factors including high blood pressure, high cholesterol, and elevated blood sugar levels under control. And the diagnosis of the following diseases can take place when the body of a patient is normal. He or she has a normal blood pressure and proper urination and proper defecation. So this is important part for the laboratory and various diseases are diagnosis for the test and these symptoms are diagnosis by the doctors. Your summary care record is a short summary of your GP medical records, and your summary of a diagnosis test plays a crucial role in maintaining a proper health. And the doctor also observes the various diagnosis tests of the patients. And after the observation of the diagnosis tests, the doctor give a proper medicine to the patient. And in the same way, the patient can be recovered from the disease very easily. So this is all about laboratory and diagnostic test. Now we will talk about communication with patient and caregivers. So what is communication? So we can define the communication is the words which are transmitted between the doctors and the patients. When the doctors and the patients talks about the body symptoms and about the disease, then the communication of them should be in a proper way so that the doctors can provide a proper treatment to the patients. And a HHA also should behave in a good way with the patients, and he should be careful while communicating with the patients. And the HHA should be play play an important role in maintaining the body symptoms of the patient. So this is all about communication with the patient and caregivers. Documentation. We have earlier talked about the documentation. Documentation is any communicable material that is used to describe, explain, or instruct regarding some attributes of an object. So, documentation is such a thing that all the details are saved in the documents because the doctor mentions the body symptoms and about the medication and about the treatment of the patient's disease. System or procedure such as its parts, assembly, installation, maintenance, and use. So, documentation is related to the patients and the doctors, and the documents are prepared by the doctors with the help of the nurses and the HHA. So, this is all about documentation. Now, we will talk about observation. Medical observation is a medical service aimed at continued care of selected patients, usually for a period of 6 to 24 hours to determine their need for inpatient admission. So, observation plays a crucial role in the treatment of the patients because a doctor goes and again for the observation of the patient's condition, and he also gives instructions to the patients and to the nurses and to the HHs. This service is usually provided in emergency departments, and observation is provided in the emergency departments like an emergency room and in ICU and any other wards. So this is all about the observation. Second one is documentation. We have earlier talked about the documentation. Third one is communication. So communication is a process that involves sending and receiving message through a verbal and non-verbal methods. So communication is a way of sending the message via verbal or and non-verbal methods because a HHA communicate with the doctors, then he puts his thoughts against the doctors and against the nurses in a verbal way. And if the messages are sent via messengers, then it will be called non-verbal method of the communication. Communication is a two-way means of communicating informing information in the form of thoughts, opinions, and ideas between two or more individuals with the purpose of building an understanding. So there are two types of means of communication because the information is shared to the another person via communication. So the HHA should be careful while communicating with the patients, and a HHA should give positive attitude to the patients, and he should be comfortable to manage the symptoms of the patient and in the proper medication. So this is all about communication. Now we will talk about follow up. So this is a very mandatory thing for the HHA to follow the roles of the doctors and nurses. When a doctor calls to the HHA, then he should go fastly towards the doctor and asks about the instructions. So this is all about the follow up. Now we will talk about patient monitoring. The act of measuring, questioning, evaluating, or otherwise observing a patient or a specimen from a patient in healthcare, the act of making a clinical judgment, the result, answer, judgment, or knowledge gained from the act of observing a patient or a specimen from a patient in healthcare. So, the act of measuring, questioning, and evaluating. If the doctor asks a question to the patient that what are the body symptoms of the patient and how the patient is feeling like, so the patient should give away all the information about the symptoms and about the disease to the doctors, so that doctors can provide a proper treatment for that particular disease. The result, answer, judgment, or knowledge gained from the act of observing a patient or a specimen from a patient in healthcare. And a doctor gets results after the observation of the patient's conditions. And he also gives instruction to the patient that what the patients have to eat, and which things are drunk by the patients. And the doctor also informs the patient that they should take nutritious food and light food while their treatment of their particular disease. This is all about patient monitoring. Now we will talk about physical assessment. When a patient goes to the doctor for the treatment, then the doctor asks several questions to the patient about the vital signs. Then the patient tells about the symptoms of the disease. Then the doctor starts the treatment of the patient. So this is all about the physical assessment. This can be related to physical assessment, collect objective data, validate subjective information, develop plan of care, evaluate effectiveness of intervention. So this is all about physical assessment. Now we will talk about medication monitoring. So monitoring is such a thing that the doctor play a crucial role in the monitoring of the medications, because when the treatment is going on of a patient, then the doctor gives the proper medication to the patients for the fast recovery of the disease. So this is very important to monitor the medication of the patients while the treatment is going on. So this is all about medication monitoring. The scope of practice for HHA in observing and reporting. Now we will discuss about the scope. Home care includes any professional support services that allow a person to live safely in their home. In-home care services can help someone who is aging and needs assistance to live independently. So home care is very necessary for the fast treatment of the disease, and HHA plays a crucial role in the home care of a patient, because he he takes time to care for the patient at any time, and he also feeds to the patient and care for the patient. In home care services can help someone who is aging and needs assistance to live independently. Is managing chronic health issues, is recovering from a medical setback, or has special needs or a disability. So, in home care, there are many services which can help the patients to recover very soon, and in the proper nutrition and in the feeding of the food, so that the patient can recover very soon. And like as the aged person who can't move from one place to another place, so then the HHA helps the patient to move from one place to another place, and also pay attention towards the situation of the patient, and gives a positive behavior towards the condition of the patient. So this is very important for the fast recovery of the disease. Communication among healthcare providers. Now we will discuss about communication among healthcare providers. Now we will talk about that who are healthcare providers. So healthcare providers are doctors, nurses, and HHAs. So these all are play a crucial role in the treatment of the patient's disease, and they communicate for the treatment of that particular disease and about the medications management. So this is related to communication among healthcare providers. Legal and regulatory compliance. Records and reports are important for documenting care communication between providers and evaluating services. So the medical records and the documents are very confidential, so that are kept in a secure situation, because the patients can have a need at any time for that particular documents, because the documents show that how the patient is recovered by that particular disease and what medications are given to the patients. The document also defines management information systems and describes their objectives and importance for supporting strategic goals, planning, and evaluating health programs. And these documents are also related to the various situations, like giving information about the patient's health and taking the advantage of various government schemes, and also getting the proper claims for the particular disease and relaxation in the amount of treatment. So this is related to legal and regulatory compliance, quality improvement and research. Now the doctors and nurses along with HHA, they need to be provide quality treatment to the patients, so that the patients can be recovered very soon and their health conditions can be better after the treatment, and the doctor should research about the proper treatment and should give a proper treatment to the patient, so that they can be recovered very soon. This is all about improvement and research. Now we will talk about facilitation of reimbursement and billing. Now this is very important part which plays a crucial role in the patient's treatment. Records and reports are important for documenting care communication between providers and evaluating services. So, the facilitation of the proper treatment. and reimbursement, because when the doctor provides the treatment to the patient, then the patient have to pay the reimbursement for that particular disease, or the patient have to pay the money for the particular treatment of the disease. So this is all about facilitation and reimbursement. Continuity of care. Now we will talk about continuity of care. Receiving care from the same dedicated provider over time, strong continuity leads to better health outcomes, enhanced patient quality of life, and improved health system costs. So this is all about continuity of care. Now we'll talk about patient care plans. The distinction between a record and a report as nouns is that a record is an item of information stored in a temporary or permanent physical medium. So, a report or a document is such a thing that are stored in at a secure place, and whenever a patient asks for the documentation, then the doctors can provide the documents to the patient easily. So this is all about the patient care plans, caregiver notes, shift logs, and the caregiver notes. Caregiver means the HHA, and the we will talk about the notes of a HHA, that what he or she is mentioning in the documents about the way of treatment and about the medications. So the HHA also mentions about the body symptoms of the patient and the process of the treatment. This is all about caregiver notes and shift logs. Vital sign records. Good record keeping can be your proof that you have made considered decisions and taken appropriate actions. So if we talk about good situation, then it is mandatory to put all the vital signs in the documents while the treatment is going on, and the doctor should take a proper action toward the treatment. Records become your protection if you are questioned or challenged. Without them you are at risk. Good record keeping can not only protect you but can support your organization in legal or other challenges. So the records are very important, and the records play a crucial role in maintaining the good health and also protection of the documents. And the documents are stored legally at a secure place, that the documents cannot be get out from the stored place. And whenever the patient asks for the documents, then the doctors can easily provide the documents to the patients. So this is all about vital signs records. Medication administration records. This is also related to the administration records, because these are the official records, and it is related to the auditor, which covers audit, and the manager who registers the records, and the administrator who observe the documentations and in which way the documents are prepared, and the service user, and the patient is a service user for the documents. So this is all about the medication administration records. Various types of records of importance for HHA. For the continuing care of the patient when they require health care in the future, a patient's medical record should provide accurate information on. So the documentation plays an important role in the security of the patient at any time. It the documents legally supports to the patient, and the documents have all the information about the disease and medications, who the patient is and who provided health care. So first thing is that who is the healthcare provider and who is the patient, what, when, why, and how services were provided, and what is the time of the admission of the patient, and when the patient is discharged, and why the patient is to be admitted, and how the patient is treated while the treatment. So these things are secured on the documents, the outcome of care and treatment. So the documentation is very necessary for the patients while the treatment is going on. Thank you all for watching the video. I hope that this video will be very helpful for you. If you want to ask a question, then you can comment in our comment section. And if you want to take our notes, then you can visit on our official website www.nursingcareerclub.com. Please like, share and subscribe our channel. Thank you again, and we will see you in the next video.